So blood dyscrasias are any disorder having to do with the blood cells. And anemia is probably the first identified blood dyscrasia, and it is probably one of the more common. There are several different types of anemia. For the learning objectives for this part, I want you to compare the pathophysiology, etiology, manifestations, diagnostic tests, and treatments for several different types of anemia. And so we'll talk about these different types of anemia. Iron deficiency, pernicious anemia, aplastic anemia, and sickle cell anemia. All different causes, all different treatments, different diagnosis. So it's pretty interesting. So anemias reduce oxygen transport in the blood because of a decrease in hemoglobin content. So the low hemoglobin level can be caused by a lot of different things. It can be caused by a decrease in the number of erythrocytes or a decrease in the amount of hemoglobin, a decrease in the production of hemoglobin. But the basic problem is there's a hemoglobin deficit. So when you have that hemoglobin deficit, you have an oxygen deficit, and that leads to lots of different things. One of the things it leads to is less energy production in all the cells, because oxygen is needed for energy production in cells. So cell metabolism and cell reproduction is diminished. So that's going to affect healing. That's going to affect energy, cellular energy throughout the body. There are compensation mechanisms that are going to occur in the body as a result of that. One of them being tachycardia, increasing the heart rate, and peripheral vasoconstriction. And these are mechanisms that are used to improve oxygen supply throughout the body. So one of the big jobs of the sympathetic nervous system, even though we think of it as the fight or flight system, its major job is to control blood flow in the major organs. So if you don't have sufficient oxygen, your sympathetic nervous system is going to go, okay, well, let's give it to the important guys because we don't care about the fingers. We care about the heart and the brain. And so let's divert. Well, so peripheral vasoconstriction is an attempt to divert oxygen from the periphery to the major organs. So that makes sense, right? So these changes lead to the general signs of anemia. So fatigue, which is excessive tiredness, pallor, which is paleness. So you're pale because you have vasoconstriction in the periphery. Makes sense. Dyspnea, which is increased effort to breathe, and tachycardia, which is a rapid heart rate. So you can see how the effects of oxygen deficit lead to those general signs of anemia. So the decreased regeneration of epithelial cells then starts to cause its own problems. It causes, so that we know that the digestive mucosa is created of epithelial cells. So the digestive tract can become inflamed and ulcerated if you are not sufficiently regenerating those cells, and that can lead to stomatitis, which is inflammation of the mouth. Inflamed and cracked lips, dysphagia, which is difficulty swallowing, and you might see degenerative changes in hair and skin. And so these are all areas where there are rapidly producing cells, epithelial cells. We're not getting regeneration of those cells, and that's a problem, right? Severe anemia may even lead to angina, which is chest pain, during stressful situations, if the oxygen supply to the heart is sufficiently reduced. So this is obviously, we're getting into chronic and severe anemia because in the early stages, the blood is restricted to the periphery so the organs can have more. Well, now we're restricting blood everywhere. Chronic and severe anemia may even cause congestive heart failure. So it's just fatigue and pallor are the start of it, and then it gets worse and worse after that. So there are different types of anemia. So there can be a deficiency of a required nutrient, like iron, for example. You can have impaired bone marrow function, and that's an aplastic anemia. You can have blood loss or excessive destruction of erythrocytes. That could cause anemia. So we're going to talk about some of the different types of anemia. So iron deficient anemia means we are deficient of a required nutrient, namely iron. Insufficient iron impairs hemoglobin synthesis. So the result is you get microcytic small cells and hypochromic red blood cells. So they're small and they're pale. It's the result of low hemoglobin concentration in the cells. So iron deficiency anemia is pretty common. It ranges from mild to severe, and it occurs in all age groups, but it more frequently occurs in women of childbearing age. Obviously, there's blood moving. There's blood being lost every month if you're a woman of childbearing age. It's estimated that 1 in 5 women is affected, so that's a lot. The proportion of anemia increases for pregnant women because their body is building another human being. They have a lot of demands on their metabolism. Um, iron deficient anemia can also be a sign of an underlying problem. So there's, besides just the reduction of the production of hemoglobin, there's also a reduction in stored iron. And they can do blood tests that measure that. And it affects the bone marrow. So there are lots of different reasons that can cause iron deficient anemia. So this is the etiology of iron deficient anemia. One of them is just dietary intake. So inadequate dietary intake of iron. So you get iron from some vegetables, you get it from meat. When you're during growth spurts, like adolescent growth spurt and pregnancy, when you need increased nutrients, that can cause a problem. During breastfeeding, when you need increased nutrients, usually only 5 to 10% of ingested iron is absorbed, but it can increase to 20% when there's a deficit. So the body's like, oh, we can't be throwing away all this extra iron. We got to use what we have, right? So just usually that's the treatment for low dietary intake, is to increase the dietary intake, including iron supplementation. And sometimes they can do pretty high levels of iron supplementation. And there are different supplements that are absorbed better or worse than others. Chronic blood loss from bleeding ulcer, hemorrhoids, cancer, excessive menstrual flow, that can be a common cause of iron deficient anemia. Continuous low loss of blood, even in small amounts, means that less of it is recycled to maintain an adequate production of hemoglobin. So if you're losing blood, once red blood cells are done with their 120-day hitch, they go off to the spleen to be separated from their hemoglobin, and the hemoglobin is recycled. So if you're just losing blood for whatever reason, you're not recycling that hemoglobin. And now not only does the body have to make new blood cells, it has to make new hemoglobin as well. And so you need even more iron. So, you can see how that would be a problem. If you have impaired duodenal absorption of iron, there are lots of different disorders that are considered malabsorption syndromes, like ileitis, achlorohydria, which is a lack of hydrochloric acid in the stomach, Crohn's disease, ulcerative colitis. The ones that affect the small intestine, usually iron is absorbed in the duodenum. And so if you have impaired absorption, you're going to have deficiency of iron and not enough iron to make hemoglobin with. Makes sense, right? Severe liver disease can cause iron deficient anemia, and it can affect iron absorption as well as storage. So our liver is our body's chemical factory. A lot of things are processed and stored and absorbed and made into a usable form in the liver. So if your liver's not doing its job, that's a problem. Um, Iron deficiency anemia can also be associated with some infections and cancers where the iron is present, but it's not being used properly, and that can lead to low hemoglobin levels, but high iron storage levels. So that, like, it's not that you don't have enough iron in your body or enough intake, it's just not being used properly. So you've got stacks of iron, but it's just not being used properly. So that can be a problem, obviously. So our manifestations are signs and symptoms, as we talk about, pallor of skin and mucous membranes. So if you have someone who has naturally dark skin, you can look for pallor inside their lips, inside their eyes, nail beds, soles of the feet. So pallor can be detected there a little more easily. Fatigue, lethargy, and cold intolerance. So cold intolerance because of that peripheral vasoconstriction. Blood, besides moving nutrients and moving oxygen, it's also transferring heat from the core of the body to the periphery. And so if you've got peripheral vasoconstriction, you're going to have, your hands are going to be colder, hands and feet and all that stuff. Irritability, that's a good symptom. It's basically a central nervous system response to hypoxia. So hypoxia results in an increased sympathetic response, and that makes you irritable and anxious, just for fun. Throw in a little anxiety as well. Degenerative changes such as brittle hair and spoon-shaped ridged nails, and that has to do with the lack of regeneration of epithelial cells. Stomatitis and glossitis, which is inflammation of the oral mucosa and the tongue, and that also has to do with not regenerating epithelial cells. Menstrual irregularities, that can be a problem. Delayed healing, because obviously you need oxygen and nutrients for healing. Tachycardia, heart palpitations, dyspnea, and syncope. Syncope is fainting. As the anemia becomes more severe, the more severe symptoms start to manifest themselves. So with iron deficient anemia, they're going to do laboratory tests. You're going to see low hemoglobin, low hematocrit, low MCV, low serum iron, and serum ferritin. The red blood cells under microscopic examination are going to appear hypochromic and microcytic. So there are a lot of things that they can test. In order to treat any kind of anemia, the underlying cause has to be identified and resolved if possible. So the treatment and the prognosis are going to depend on the cause. If it's purely dietary, then obviously iron-rich foods and iron supplements are going to be administered. If usually with iron supplements, they want you to take it with food to avoid stomach irritation. And there are liquid iron mixtures that you can take. And that is, if dietary is the issue, that's how it's done. Otherwise, they have to figure out what the issue is and resolve that before you can resolve the anemia. So anemia can be a symptom of something else. Pernicious anemia, it's also known as megaloblastic anemia. It's a vitamin B12 deficiency. So it's characterized by large immature nucleated erythrocytes. Those are the megaloblasts. That's why they call it megaloblastic anemia. They are usually, pernicious anemia results from a deficit of folic acid, vitamin B6, or vitamin B12. Vitamin deficiencies usually develop gradually. It's not like a sudden onset. There's folic acid deficiency has some pretty devastating effects in pregnancy, potentially. And you'll talk more about that in neuro because they're neuro effects. It's usually recommended that if you're planning on getting pregnant, you want to take prenatal vitamins a couple months before. Both parents should take it. But pernicious anemia is the common form of megaloblastic anemia, which is caused by malabsorption of vitamin B12 because of a lack of intrinsic factor, which is produced in the gastric mucosa. So the intrinsic factor is required for the intestinal absorption of vitamin B12. So it's not necessarily a dietary deficiency, it's that you can't process the B12. Those big megalocytes, the immature nucleated erythrocytes, carry less hemoglobin and they have a shorter lifespan. So that's what causes the anemia part of pernicious anemia. Vitamin B12 is also needed for the function and maintenance of neurons. So a significant deficit of the vitamin can cause symptoms in the peripheral nerves, which can be reversible. They can also cause cognitive effects, just to make it interesting. Just to make it interesting. So there's another problem when you have atrophy of the stomach mucosa. It's called achlorohydria because the cells are not producing hydrochloric acid. And achlorohydria interferes with digestion of protein in the stomach and the absorption of iron. So that can result in iron deficiency anemia along with pernicious anemia, just to make it interesting. So the deficit of B12 leads to the impaired maturation of the red blood cells because it interferes with DNA synthesis. So that's why you get those megaloblasts. And it impairs hemoglobin carrying and lifespan, and so that's why you get the effects of anemia. So it's not usually a deficiency of vitamin B12. There are some genetic factors that might have been implicated. It's more common in light-skinned women of Northern European ancestry. Raise your hand. That's maybe a lot of us. I don't know, a lot of us in the US. It often accompanies chronic gastritis because of the intrinsic factor effects, and it also might be the outcome of gastric surgery. So the most common cause of vitamin B12 deficiency, usually the source of dietary sources of vitamin B12 are animal sources. So if you're a vegan, you should take a vitamin B12 supplement, and there are non-animal vitamin B12 supplements available for vegans. So that's one of the few things that you need to supplement as a vegan, but B12 is one of them, because most of the dietary sources we get are from protein, fats, and dairy, animal proteins, animal fats, and dairy. So if you don't eat dairy, take a B12 supplement. But the most common cause is malabsorption rather than lack of intake. And so a lot of times it's an autoimmune reaction, particularly in older people, from chronic gastritis. So chronic gastritis can be common in alcoholics and not necessarily alcohol, but other people. Just atrophy of the gastric mucosa, inflammatory conditions can cause it, and it can also be an outcome of gastric surgery if you have to have part of your stomach removed or resected, which could happen for lots of different reasons. If they remove parietal cells or resect the ileum is the site of absorption, and so absorption, processing, intake, all of those things can affect it. So the signs and symptoms, or the manifestations, include an enlarged red and sore tongue, and shiny red and sore. Decreasing gastric acids lead to digestive discomfort, often with nausea and diarrhea. Feeling of pins and needles and tingling in the limb, that's a neurological effect. That pins and needles feeling, we call it paresthesia. And it can also result in loss of muscle control or coordination, which we refer to as ataxia. So they're going to do microscopic examination looking for those megaloblastic or macrocytic erythrocytes. They are going to look for increased number of megaloblasts. They're looking for hypersegmented granulocytes and a decrease in number of them. they're looking for hyperactive bone marrow if they do a bone marrow biopsy. Vitamin B12 level in the blood serum is measured, and it's found to be below normal. And the presence of hypochlorhydria or achlorhydria, and that shows that you have gastric atrophy. So lots of different things they're going to use to get a diagnosis of pernicious anemia. Usually the treatment for pernicious anemia is they're going to give you oral B12 supplements, but usually it's administered by injection because it might not survive the stomach. It's replacement therapy basically, but the earlier diagnosis and treatment you get, the less cardiac stress and neurological damage happens. So early diagnosis and treatment is really important for probably for everything, but for things like this, which are not too bad when they start, but then they're horrible later on. So those are two types of anemia. And then in the next section, we're going to talk about a couple more types of anemia.